Why is it important for me to see a primary care provider before I get pregnant?
Well, because the period before conception is the preconception care. It's a very crucial step to have a healthy pregnancy. It's pretty much where it's the time where physicians are able to identify the multiple risk factors that can implicate and impact pregnancy in a negative way, such as we are able to identify behavioral risk factor, social risk factor, biomedical risk factor that can negatively impact pregnancy, and with a goal to minimize those risk factors and possibly terminate it.
To add on to that, when you look at typical prenatal care usually is going to begin hopefully at middle to the end of the first trimester. But when you look across the U.S., over 30% of pregnancies don't receive prenatal care until after 13 weeks. When you look at fetal development, organogenesis, the development of the nervous system and the organs, all occur in the first few weeks after conception. When you look at a pregnancy, you're going to conceive 2 weeks before you would have missed a period. By the time you realize that you're pregnant, you're already 3 or 4 weeks into your pregnancy course. By that time, neural tube development is complete. Organogenesis is well underway, and preconception care is much more important in preventing birth defects than prenatal care is. So by taking a woman and placing her on folic acid supplementation, 0.4 milligrams once a day, anytime during childbearing age, is going to decrease her risk of neural tube defects. Identifying problems that the patient may have, diabetes, high blood pressure, obesity, tobacco use, medication use that is not safe with pregnancy. If we know a patient is trying to get pregnant, we can discuss that with her and try to get her off of medications that may be teratogenic or cause birth defects, and find medications that do not. Do you have more you want to add on disease management or disease risk?
Yeah, some of the chronic conditions that we need to take care of during the preconception care is obesity. Obesity is actually involved in more than 25% of the pregnancy complications, because it actually increases risk of C-sections, prolongation of labor, increases birth defects, gestational diabetes, gestational hypertension. So it's very important for us to have a discussion with the mothers before they are trying to conceive, and we can educate them about ways to lose weight, and encourage them to be involved in weight loss programs, possibly start them on medication for weight loss, or even consider surgeries for them, at least for better overall health and better healthy pregnancy.
I think also that would that preconception visit, kind of what you can expect if you come in to talk to us about the fact that you're considering pregnancy, in addition to managing your chronic conditions. We can also look at your readiness in life to have a baby. We look at your socioeconomic status. Are you in a home that has heating and air conditioning? Do you have access to resources? And if you do not, that's where our perinatal navigators, our community services can come in handy to make sure that we try to keep you as healthy as we possibly can. A lot of these conditions, when you look at optimal control of diabetes, optimal control of hypertension, weight loss, allowing you to try to stop or cut back or change your tobacco use, those are conditions that sometimes take several months to get under control. So if we could try to see you and get you tuned up as well as possible before you conceive, we overall improve the outcome of your pregnancy, or at least the chances that you're going to have a healthy, happy pregnancy and successful delivery.
I want to try for a baby in a year. What can I start doing now to have a healthy pregnancy?
Folic acid, number one. Start with folic acid, 0.4 milligrams a day.
Yeah, you want to go ahead with
Sure. I like the idea of getting into some form of routine exercise regimen. Try to get your physical state as good as you possibly can. Sit down with your provider and identify those risk factors. If you have travel upcoming, it's nice to let your provider know about that. Certain areas, especially prior to coronavirus, we were dealing with Zika virus, and certain areas are not safe to be in when you're considering conception of an infant. That initial counseling should involve your job, your workplace. Are you exposed to solvents, cleaners, mercury? What can we do to try to get you in a safe environment through your workplace to be able to carry a pregnancy? If you're a pharmacist or a nurse, do you need to be handling Category X medications? These are medications that we know have teratogenic effects. And if I'm talking to a pharmacist for her preconception visit, I'm going to talk to her about the dangers of finasteride and the dangers of Accutane and the dangers of the medications that potentially may cause this problem. And even if you're not prescribed those, the recommendations are that you not handle those pills, that you let somebody else take care of the pregnancy X medications if you're going to be considering pregnancy. Again, tobacco use, we've already touched on that, but being able to help you try to stop your tobacco habit before pregnancy. Tobacco use in pregnancy has numerous poor outcomes to include placental abruption and small for gestational age babies, fetal demise, preterm deliveries, preeclampsia risks. The list goes on and on with tobacco use, the dangers with it. And there are medications we can give you to help you stop your tobacco use, but some of those medications are not always the safest with pregnancy. So maybe we need to work on getting your tobacco cessation for the first couple of months or a few months, and then have you try to conceive once we've got you successfully off of the tobacco habit.
I want to get pregnant, but I have diabetes. What should I be looking out for?
Well, it's certainly safe to be pregnant when you have diabetes, but there are certain things you have to look at. Some of the medication that I use to manage diabetes is not safe during pregnancy, so we have to alter those medication. Uncontrolled diabetes, as well as associated with increased risk of congenital defects, is stated actually you have 2 to 4-fold increase in the risk of having congenital abnormalities if you have uncontrolled diabetes. So before we try to establish pregnancy or get the mother get pregnant, we need to have better glycemic control, better blood sugar control, and that can be done with multiple ways. I mean, weight loss, good dieting, and more strict medication regimen. Because diabetes itself is associated with birth defects, most for gestational age, large for gestational age, increases of risk of C-sections, and other comorbidities during pregnancy.
When you look at late pregnancy diabetes that is poorly controlled, has multiple risk factors. Number one, higher risk for C-section, but it increases a lot of things you would suspect. It increases your risk for preeclampsia, increases your risk for large babies or small babies. It can go either way. If you have placental insufficiency, you're going to have smaller babies. If you've got a baby that's being overfed because of high glucose all the time, you're going to have big babies. Polyhydramnios is a condition that we see sometimes that can complicate pregnancies where there's too much fluid around the baby. There are potential complications with shoulder dystocia, with, again, C-section risk. I missed any that you're aware of?
No, pretty much we covered it.
Okay.
Yeah.
So anyway, diabetes with pregnancy is not a contraindication. It's no reason not to get pregnant, but you do want to stay under as good a control as you possibly can through the pregnancy. And being able to start the pregnancy with a hemoglobin A1C, which is a test we used to look at how good your control has been over the last 3 months. If we can get that hemoglobin A1C in the low 6s or less, your risk of a successful pregnancy is going to be a whole lot better than in patients whose diabetes is much more poorly controlled.